Hello, everybody. This is Brian Cosin at SIL Insurance Agency. Thanks so much for joining us for this ERISA Solution Benefit Compliance Challenges webinar. I think it'll give you a lot of information about the ERISA requirements and how to pass an ERISA audit, which is a continuously overlooked, very important Department of Labor requirement. I'm glad you could join us today. Hopefully we'll keep this within 45 minutes or so. At the end we'll have an opportunity for some Q&A if we have time. But right now I want to introduce who our speaker is. This is Ken Spencer. He's with HR Services and ERISA Compliance. Ken has over 30 years of professional compliance and human resource management experience. Mr. Spencer formed HR Services Incorporated and ERISA Solutions in 2004. And they provide extensive compliance, ERISA, and HR solutions for clients and brokers across the country. Some of their services are employee notices, 125 POP documents, which is pre-taxing, SPD wraps, and HR solutions for thousands of clients around the country. HR Services is a certified solutions provider for the United Benefit Advisors and member of the National Association of Health Underwriters. Real couple seconds about Ken's qualifications. Ken taught compliance, leadership, and HR courses for 8 years at Westminster College and taught employment law at the University of Phoenix. Mr. Spencer earned a master's degree in human resource management from the University of Utah and holds bachelor degrees in marketing and finance. Mr. Spencer was certified in change management techniques and a certified senior professional in human resources, and it has multiple certifications through national organizations. So Ken, you sound like you're very qualified to lead this discussion and webinar, and take it away.
Great, thanks, Brian. Really appreciate the introduction and the opportunity to discuss these important items with each of you today. We're going to start out our discussion talking about some of the various challenges that you're being faced with out there, and then we'll, time permitting, we'll go into more detail on some of these things like preparing for the audits. You even have some employer reporting requirements coming on for some folks if you have 50 or more participants. So if we have time, we'll go into a little bit on those things as well. One of the first challenges, and Brian had alluded to this as well, is just being audit ready for ERISA. The Department of Labor has hired more auditors. They're the enforcers of this law. The law ERISA stands for the Employee Retirement Income Security Act. And that's the law that oversees all health and welfare benefit plans, medical, dental, life, disability, etc. So they're auditing, but they've hired more auditors. They're auditing groups of all sizes. I believe a big push for this has been because of the Affordable Care Act and the changes, with that coming out, there's a lot more they're wanting to make sure people are compliant with that. There's probably a little bit of a revenue search as well, but they are auditing. We had a 15-person company audited a few months ago. We've had a 40-person group audited, as well as multiple others. So we'll touch bases on a few of those things. A very high-level view at first here regarding this on the audit, and then we'll come back to this a little bit later on in our discussion. They're looking for a number of things. The audit will start by you receiving a letter from them. And the audit could be triggered either by could be a complaint, could be part of another audit if they're auditing you for other things with the Department of Labor, or maybe even they're auditing a 401k plan or something like that. But it can also just be random. We're hearing rumors that they are randomly, that they are planning on auditing everyone eventually. But so a few things that they're looking for, and again, this is a high-level view of about a 4 or 5 page document that you would receive there. One of the first things they ask for is a summary plan description, or a summary plan description wrap document. And what a summary plan description is, it provides all the information that ERISA wants you to receive, wants your participants to receive, that's explaining the details of their coverage and their rights and everything. So it includes a lot of different components, and we'll show you more on that in a moment as well. So what you could do is separately prepare and create summary plan descriptions for each benefit, medical, dental, life, disability. Or what a more popular approach is using what's called a summary plan description wrap document. What a wrap document does is it creates one overall plan document, one overall summary SPD, and then it wraps around all of your benefit plans, your medical, dental, life, disability, and it pulls in the missing insurance company information, tying in the required ERISA language all into one document. It's a little bit more of a simplified approach, and they're okay with that. Sometimes they'll even ask for that. The other thing, they're looking for various notices, and we'll go into more details on some of these notices. Of course, they're checking for some of the triggering events like COBRA. You know, when somebody has a qualifying event, are you sending out those COBRA notices and their rights to continue insurance? For groups who have 100 or more participants in a given benefit plan, they have to submit in Form 5500 reports, and those have to go in every year, and there's some pretty stiff penalties if you're late on those. And then, of course, they're also checking on some healthcare reform compliance areas. So they're verifying have you implemented all the various phases of the healthcare reform, so questions on that as well. So these are, again, this is a very high-level view. We'll go into a little more detail on some of what you can do later in our discussion. And there's also this challenge of making sure that you're getting out all the various employee notification requirements. Just by virtue of offering medical insurance, there's a number of notices that may come into play based on the size of your group, how your benefits are set up. You know, so you've got everything here. We've got, you know, the COBRA. There's an initial COBRA, and then there's a qualifying event COBRA. And I think most of you are pretty up on those. This is an area where people are pretty strong. There's a notice called the Children's Health Insurance Plan, or CHIP. There's a Mental Health and Parity notice, Newborns, Mother's Health Protection Act. There's a Women's Health and Cancer Rights Act notice, Patient Protection. There's a HIPAA notice. There's a couple here that may only apply if you offer a wellness plan, for example. If you have a wellness plan, then there's a wellness plan notice. If you have a grandfather plan, and there's not too many of those left, there's a grandfather plan notice. So most of those have been priced out of the market. Most of them aren't around any longer. Then there's a notice for GINA, FMLA, USERA, Medicare Part D. There's what's called a health exchange notice as well. Now the exchange notice is one that was due back in October of 2013. We were told to get it out to all participants. Actually, it was to go out to all employees, not just participants. And so as long as you've done that back in October, and then since then, you're supposed to get that notice now to all new hires. So we don't have to resend that notice out again every year. Where these others, often you'll send them out every year. But the health exchange, again, that only has to go out the one time to everyone, so all new hires should get that. These other notices only apply to participants in the plan. And then, of course, we talked briefly about summary plan descriptions or wrap documents already. There's also what's called a summary of material modification. So anytime you have a change in a benefit plan where the change is considered material, meaning that the benefits went up or benefits went down in some way, then you're to notify participants of that change. Now, formally, they call it a summary of material modification, but there's other ways you could get that out. As long as you're communicating what changed, how does it impact them, what's the date, those are the critical things. But then you should also save and record that information so you can demonstrate you've communicated all changes. I'll show you a tool in a moment of how that'll help with that and help with all these notices and everything as well. You also need to get out what's called the summary of benefits and coverage. So that one, I think folks are pretty good about that and COBRA. It's the others that have been a little bit hit and miss if they're happening. And so again, I'm going to show you a tool in just a moment to help you with these notices. The other challenge that's out there is just keeping current on all of the various changes that's going on with employment laws, whether it's healthcare reform or ERISA or other laws like Fair Labor Standards Act, Family Medical Leave Act, all these other laws that are out there. So I'm going to show you also a tool to help keep you informed, because if you don't know what's going on, if you don't know the changes, you really don't have a chance of being compliant. A lot of you may have other sources and resources for that, and that's great. We hope that you do. But I'll show you a resource here for that in just a moment as well. Another challenge, another benefit challenge, is folks are not properly handling their protected health information within their system, so they're not fully compliant with HIPAA. HIPAA requires that you manage the protected health information in a way that it's secured and protected, both electronically and physically. So, making sure that you have systems in place to secure that data. If you're transferring it back and forth to the healthcare providers, or even between you and Brian, you got to make sure that you're securing that data with either a password protection or some sort of secured system. Also need to make sure you have business associate agreements with anyone who you're sharing protected health information with. So I'll show you some tools and ways to help with your HIPAA compliance as well here in just a moment. Another challenge that's out there is there's been a lot of changes. Just last year, there were a couple of changes in the 125 premium only plan document. So a lot of you might recognize this document. A premium only plan document allows your participants in the plan, if they're sharing in the costs on such things as medical, dental, even a lot of the voluntary benefit plans, if they're sharing in costs on those, you can pay for them, they can pay for them on a pre-tax basis, which saves them tax as well as saving you the tax, because now you don't have to match the Social Security on that amount of money on the pre-tax. But those documents are out of date. There were changes that went on last year where they've had changes in the definition of spouse. There were changes in eligibility, and so if you haven't updated your document since then, you might want to look at either having your current document amended or maybe even just replaced. And I'll show you an option there as well. Now, before I come back to the more details on preparing for audits, and perhaps a little bit of a discussion on the Affordable Care, or the healthcare reporting requirements, I'm going to take a moment and just show you an option that's available. One of the things, because Brian's wanting to look out for you and make sure you're legally compliant and that you're able to meet all these requirements, he's pulled in our organization to be a resource for you. And there's a service that's available that you get some special pricing at, which is called Compliance Basics Plus, that helps address the problems we just talked about. So if it's okay, I'm going to take just a second and walk you through what this does and show you how it helps you and addresses all of those 5 problems. And then we'll come back and go into more on the preparing for audits and such. One of the first things that this does, this service tells you what you need to know and do every month from a legal standpoint. So once a month, you're going to receive an email, and we can have this sent to anyone at your office that will tell you what's changed from a legal standpoint. It gives you key due date reminders as well. So just for example, in February, there's an OSHA posting requirement. So we notify you the month before about the OSHA posting requirement. In September, there's an EEO1 report due if you have 100 or more participants. So these are just some examples of the due date reminder type things that take place in there. Here's an example of an update. So you'll see in here we provide key compliance reminders of changes given the dates that they're taking place. We also show you key federal changes and letting you know what's going on with federal changes. It might be changes in healthcare reform. It might be changes in Fair Labor Standards Act, and so on. Then we also give you state-by-state changes. So you can go in and you can look in all of the states where you have employees, and any of them where it's highlighted and underlined, that means there were changes there. So if there were no changes, if it's not highlighted, you don't need to worry about that. So you go in any state where you have employees, and you can see what's changed or what do I need to know in that state. So again, this is an approach to give you federal and state all employment law updates is just the first piece of this Compliance Basics Plus service. The next thing it will give you, the legal update gives you what's changed and what's going on. This will also provide you with the how-to, some best practice techniques. You'll receive once a month a bulletin that covers different topics, like in January, for example, we sent out an article on the Affordable Care Act employer reporting requirements. So what do you need to do now to prepare for that? We've covered wellness plans. Sometimes we even cover some compliance and HR techniques as well. So you'll see, we find people really like this article. It gives them a lot of great ideas, and they can share it with anyone in their organization. Here's an example of one on how to pass an ERISA audit. What do you have to do to prepare for that? Now, back to this list of all these employee notice requirements. The notice requirements that I show in this bracket here, we've set up a web-based tool, and I'll actually go into that web-based tool and show you how this looks and how it works. The web-based tool allows you to go in, you answer some simple questions about your business, about your benefit plan. The only questions that are asked in that section are what's needed to determine which notice applies and to get the information to fill it out. Because ultimately you'll push a button that says generate employee notices, and then the system then will pull in which notice applies, fills it out, and emails it to you in a ready-to-deliver format. So I don't know about you, but we find it's a challenge getting people to get all the notices out. And so if we can make this simple, then it makes it so much easier to do. And I'll go in and we'll actually run a notice, and I'll show you what that looks like. The other thing that you're going to see when we go inside the system, there's a web-based tool also for what's called the Summary Plan Description Wrap service. So inside of this wrap service, you'll see you're able to go in and create, answer questions, store your data, generate your Summary Plan Description Wrap document, and then distribute it out to this one goes to participants in the plan. And it's emailed out to you with instructions on what to include with it. So when you generate a Summary Plan Description Wrap document, you'll then attach to it information about each of the benefit plans that explain the details on how that works. Now I see a note here from Steve. Looks like it said something about the audio stopped. I just wanted to make sure that everyone else could still hear me okay. If one of you would please send, you notice you got a place there where you can send questions. Okay, I see it is working now. Thank you, Steve. I appreciate that. Okay, so coming back to this, when you'll see one of the requirements with an SPD or Summary Plan Description Wrap document, you have to attach something that explains the details of that benefit. And so you need to, so that might be certificates of insurance. You may have a brochure that explains the details of each of those benefits. There's lots of different things that might suffice for that information. With that, let's go into, I'm actually going to go into the web-based tool for just a moment, and we'll show you what that looks like. So if I'm logging in as a client for a moment, I'll show you what this looks like. So this takes you into our compliance center. Now I'm in with someone else, and and so I'm seeing this other information here. But I'm in this compliance center. So once I'm inside of here, I have a number of tools and drop downs that give me the resources I need to be fully compliant. So one of the things, for example, we were just talking about is generating this all-in-one notice. So if I go under Employee Notices, Employee Notice Report, this is where I can go in here. I can answer the various questions, and then I can so I answer questions about my company, questions about my medical insurance. And then I come down here, and then I can actually generate my employee notice document. If I were to generate that right now, before I do that, I wanted to show you also over here is the health exchange notice. And we've separated the notices because this first one, when I generate it, it's going to generate it'll generate all of the notices inside of this bracket. And those notices go to participants in the plan. But remember, the health exchange notice has to go out to everyone. That's why we keep that notice separate. So if we generate that notice, that one would go separately, and that would go out to everybody. So if I generate this notice right now, so I just click that button. Now the system is processing. Okay, now it's generated the notice. It's actually emailed it to me. So if I go out here into my email now, and I'm going to do a refresh screen and let that email come across. And here it is right here. Okay, so now that email came to me with all of my notices all in one. And now it's giving me instructions on what to do with it. It even gives me instructions on how to send it out. And by the way, I'm going to spend just a second here on delivery of notices or on delivery of SPD wrap documents, because this is an important thing as well. There's more details that you can click inside of here to get information on this. But you can do it electronically, where you're sending it to a regular work email, posting it to an intranet. You can also send it out to personal emails, as long as you have written authorization from participants to do that. If you're going to post it on an intranet, you have to make sure that you still individually notify each person of where those notices are or where your SPD wrap documents are. So you have to make sure you're notifying them. If you prefer a non-electronic option, you can mail it to someone. You can hand deliver it. You can even do a public publication, company publication. And again, there's more details that's sent out where you can go in and get more information on each of those. So back to this notices now. So the notices now, you have instructions on what to do with it. If I were to click and launch that, you see this opens up now, and it'll come with my business logo. Let me just launch that. So that would be your logo. This is a test company. Then it contains now all of the different notices. So here's the HIPAA, here's the CHIP, here's the women's health and cancer, the newborns, USERA, GINA. You can just see we've got all the notices now here, all on one delivery option, right on down to I've got the initial COBRA. Here's my Medicare Part D. So this makes it really nice. It's easy for me to easily generate that document and send one a year. We recommend you do that right at the same time you do your open enrollment, so that you're able to you'll have all that new information on your new benefit plans, and then you just go back into here again, answer any changes about benefits, anything that's occurred differently here, and then generate your document again and distribute that once a year to all participants in the plan. And then always keep a current health exchange notice on hand that you give out to all new hires. And so again, the goal here is to make this compliance as easy as possible. Now, just to show you a couple of other tools that you have inside of here, we also talked about this SPD wrap document. So if I had the SPD wrap document, one is I could go in and watch a video on it, on how to do it. But if I click this SPD wrap option here, you'll see I can come in here and I've got this data center now that saves all of my information. So I can come in here, fill out this basic information, indicate which benefit plans that you have, and then you'll see down here, and I won't go into detail on every section, but we have to cover eligibility. We have to cover what happens when if I have a measurement period. And I don't know if everyone's familiar with what a measurement period is. Let me just briefly explain that. But if each of you should define a time period where you're measuring eligibility, so you can determine who's eligible for benefits. So that could be anywhere from 3 to 12 months, and so you find that eligibility option. So that 3 to 12 months, you're looking back over the last 3 months. I'm going to use 12 months as an example. I think this is probably the most popular. So let's say I'm using 12 months as my measurement period. I look back over the past year, and I measure the average work hours for each of my employees. And anyone who has 30 hours or more, now they're eligible for medical insurance. And I have an administrative period where I have some time there where I can do my calculations, determine who is eligible before I have to implement them, according to our defined waiting periods and starting periods. And I think everyone knows that they have to have them starting on their coverage within 90 days. So there's that option where you put in this kind of information here. Then you also would cover what happens when each of the benefits terminate, your open enrollment time period, your planned year. Going on down, then you cover some details on each of the benefit plans. So here's a dental plan, a vision plan, life, supplemental, LTD, short-term disability. Now, in this particular one, I didn't show a medical plan, but there isn't. Obviously, there's an option. What has happened is they said they had purchased their insurance over the shop in this particular one. So if I take that off and then come back up here and indicate which benefits they have, okay, so now the medical would show down below. So you see inside the medical here, it asks for basic information about the plan, information about if they're self-insured, fully insured. Do you offer an HSA? If so, do you have contributions to that? You can include rates inside of the system. You can cover rates as a % or dollar amount. Or if you prefer, there's an option up here that says, I prefer to skip showing rates, because you may have already passed out insurance rates during open enrollment, and then you wouldn't have to do it again. Now, if I check that box, now you see it all disappears inside of here. So once I fill out this basic information, now I can come down here. I can either save and exit, or I can generate a document. And if I generate the document, it'll create a date. It'll send me the information. So if I click for it to come to me, if for some reason you were there, if you were, you could click the client here, and then it comes directly to you. So you can see here it's just another tool to help, again, make compliance easy, so you're meeting those requirements of the summary plan descriptions. And so this is a way to save and generate all that information. So if you coming back out of here, and I didn't generate that document, it would come the same way that the other document came with the all-in-one notice that we just went through a moment ago. So that's how that would arrive. There's also what's called a SMM, or a summary of material modification feature. So if I click this, I can come in here. Now this is back to, remember I defined summary of material modification for you just a moment ago. If you have a change in a benefit that's considered material, benefits go up or down, then you're required to communicate to all participants using a summary of material modification. So this gives you a tool to create that. You could come in here, so if it were a medical insurance, I check medical insurance, I could either attach something to explain what changed, and that's usually the most popular way, or if I wanted to, I could just explain the change. So, and then I indicate the date that the change occurred, and then what kind of a modification was it? Provisions that establish new benefits, changes that eliminate benefits, or one of these other options. If that's the only change that I'm communicating, then I can generate my summary of material modification. And when I generate it here, this is a little different than the others. The others emailed it out to you. This is just, it pops it up as an immediate download. Now, rather than generating one right now, I'm going to click here because it saves them in a history. So I could go in here and actually download one of the past summary of material modifications. So if I click to download that, and then you can see down here where it says you want to download, I can either save it or open up the document. In this particular case, I'll just open it up. So now I've opened this document, and now I've got a summary of material modifications ready to go out to participants to help them so I make sure I'm compliant with this requirement. You'll see it's addressed to participants and beneficiaries. It explains which benefit plan changed. In this case here, it says what's the reason for it, and provision that established new benefits. Here's the date, and then here's a summary of the change. In this case here, we just said, see attached for information and details on it. And then this modification then connects them to, it gives them contact information, connects them to the SPD wrap document. So it's just kind of a nice formal way to take care of those summary of material modifications as well for you. So, okay, so coming back here to some of these web-based tools for a moment, there is a section here to help you with all of your, we talked about HIPAA compliance. So if I wanted to solve my HIPAA compliance issues, I could go in here under Covered Entity Determination, determine what level of HIPAA applies to me, and then I have steps here to create my HIPAA compliance program. And then I come back in here to the tools, and I can actually, then I've got policies to set up my HIPAA policy, and I've got forms and documents to help me implement it. So for example, it's good to have what's called a business associate agreement with anyone who helps manage protected health information. A really good goal for you as an organization is to strive to not have much handling of protected health information. More and more, you're getting to where you maybe don't have to handle so much of that yourself. So to the extent possible, that's a good goal. But if anyone outside of your organization is handling protected health information, you want to make sure that you have this business associate agreement. And protected health information is information that's specific about an individual, and they can be identified, and it's about their medical condition. So often some of your insurance companies may provide you with data on claims history, for example. Now you get, that's highly protected information. Historically, we used to have to fill out job applications where it had details about someone's medical condition and coverage. There's still some cases where you're filling that out if you're doing self-funded plans and such, but now with the healthcare reform, there's less and less of that. But nonetheless, I just wanted to show you, that tool that's there. A couple other things here, and I won't go into much more detail inside the web-based tools, but you do have access to all of the past legal updates. You have access to a legal topics library where you can search for things here. We have a section here for all new hire forms and documents. Most of you already have this stuff. It's just nice to have a one-place stop where you can get the latest I-9, W-4, direct deposit, job application, any of those kinds of forms. We're actually updating this soon. We're going to be adding in a lot of other useful forms and documents and templates inside of here. So you'll see that within in the next 30 days. There's also a section here where you can get access to all of our past best practice articles. So we've covered every kind of topic you can imagine in here. I mentioned we did the Affordable Care Act Employer Reporting Requirements article. And in fact, when I'm done with this meeting, I'm going to forward this over to Brian, and he'll make this available to each of you. So he'll forward this around. But this is one example of an article that we've done. So we take one topic each month. Once a year, we provide you with a legal update where we give you a full, every month you get a legal update, but once a year we give you a full compliance calendar. So the calendar shows you at a glance the whole year, the dates, what are the compliance issues, and then what are your actions needed to be compliant. And so this is another nice tool. We give you that in December. And then throughout the year, as items come up, then you're reminded, with each of these. Of course, if you also had the service has an option to include the 125 premium only plan document. So, and I mentioned before, most of them are out of date, so you might want this. Similarly, you could click here and go in and create and download your 125 premium only plan document. I just received a note saying, well, how do we get access to all of this? Let me show you how you get access to this, and then we'll come back and go over a few more compliance items in wrapping up our discussion here today. So if I were, let's go ahead and I'll log out of this. So because of your relationship with Brian and SIL, again, they've found the tool to help you because they want to make sure that they're keeping you legally compliant and making things simple and easy for you. And so, by partnering with us, you're able to do that. You'll see if you go to hrserviceinc.com. So if you were just to go to our homepage at hrserviceinc.com, along the top here, If you wanted to see more details about any of the packages we just talked about, there's an option in here called Compliance Basics Plus, and that's the one we just went through. So that's the service we highlighted today. But if I wanted to get started with this, let's say that this all looked of interest to me and something I would like to do, then you would click this Get Started Now button. You would come in here and select which service level that you want. Now, what we've talked about and probably our most popular is the Compliance Basics Plus, SPD Wrap, and POP. And what this does is it gives you everything. So it's kind of a comprehensive compliance solution to help you with all parts of your compliance. And we talked about the legal updates, the bulletins, the all-in-one notice, the web-based tools, the wrap document, the POP document, everything. And that's $279 a year minus another 5% you get because of your relationship with Brian and SIL. So if I wanted this service now, if I just click that box and then I say next, you'll see in here, now I create a username and password that I will use later on to log back in to use the tools and web, to do the SPD wrap or my POP or my all-in-one notice, anything in the web-based tools. So you create your username and password, you retype it, and then it asks for what's called a partner key. Your special partner key, and this is one that's set up for Brian and his group, is 1364. So if you put in 1364, this will give you another 5% off. I know it's not huge, but neither is $279 a year, because we're trying to set this up to where, most of the folks who set this up continue year after year just because now they've got a tool and a solution that can help keep them compliant with all their notices, their wraps, their POPs, their legal updates, everything they need to know and do. So if you put that in there, then if there's no promotional code, if I just say next, then it'll ask me for my name, my company's name, address, phone number, and then the next screen then would be a credit card. So you would just pay with a credit card. If you're able to do it this way, you get the 5% off. If you're wanting to get set up and you don't want to use a credit card, you could just call us, and this is our toll-free number right here. So you can just call us 855-447-3375. We could set you up where we send you an invoice. So if you prefer that, we can go that route, but you don't get the 5% off. So that's just an option there. But it is as simple as just clicking at Get Started Now, checking the service that you want, hitting next, putting your username and password, and then put in that partner key to 1364. Okay, so that's literally how you would sign up for the service. Just as simple as that. So let me just open up if there are any questions about anything we've gone through so far here. I've given a high-level view of this, some of the service options here. What we've talked about today so far was, the legal update solutions, or you get the email, the web-based tools. We've gone through that. We talked about the POP document, or I'm sorry, the summary plan description. The POP document is very similar to the summary plan description in that, you answer a few questions, it generates and saves your information. There is a section in there also where you can go in and do discrimination testing. There's various requirements to make sure that your plan is not considered discriminatory. So it will help with that as well. So in setting that up, let's go back. Actually, Brian mentioned we wanted to keep this to 45 minutes, and so we're at about that now. So what I'm going to do, instead of going into more detail on the passing ERISA audit or the Affordable Care Act, what I will do is I'll send articles over to Brian, and anyone who's on here, I actually can forward that out to you as well. But I'll get you that information, and we'll include some more information on this service and the rates as well with what we send out to you. Again, we'd love to be a resource to help you be compliant and help take care of all these things. There are various options here. If you don't need a 125 POP document, then that's the cost for you. So there's different rate options here. depending on what service you go with. The most popular is the top one here. Okay, there's a question here. I'm just going to read the question. Okay, it says, I am just curious if all of this information should be provided to us by our Anthem representative, all the forms and changes. It's a great question. So a lot of the information you could get from your insurance provider. So if there's something that you don't know when you're filling out for the notices or for the SPD wrap document, also for the information you would need to attach to that document, the SPD wrap, and sending it out. So the certificates of insurance or details, brochures, summary benefits and coverage, you would be able to get that directly from your insurance provider. Of course, Brian and SIL are there as well to help you in guiding you through that process, answering questions, and assisting you. And in HR service, part of our services is we'll assist you with any questions on how to use the service and such as well. So that's part of the service that comes with that too. With that, let me just open it up if there's any questions, and I'm going to show my phone number and contact information here. So if you want to email me with further follow-up questions, my email is ken@hrserviceinc.com. or my direct line is 801-685-8400 extension 6, or if you use that toll-free number you had just a moment ago, and then extension 6, either of those numbers would come directly to me. So Brian, I'm going to come back to you if there's anything else that you wanted to, if you had anything else in wrapping things up here for us. It looks like I don't have any other questions immediately, but please feel free to follow up with myself or Brian with anything we can help you with. Again, our goal is to make sure that you're fully legally compliant with everything for ERISA, all the benefit compliance, and more with our service. We're actually covering all employment laws as well. So, all right. Brian, is there anything else from your end?
No, Ken, I think you covered it pretty extensively. As you can see, everybody, there's a litany of requirements and documents and notices and things like that. And we've done extensive research and have found that HR Services provides a very comprehensive package at what I think is a very, very low cost. And Ken is very helpful, and their support team is very helpful in following up and getting back with people and even available on the phone for questions when a person's completing these online questions. But Ken, thanks very much. I really do appreciate it. This will be recorded and will be sent out to everybody that if they would like to listen to it again at their own leisure, that will be emailed out to everybody again as soon as we get it from you, Ken. So thank you very much. I really do appreciate your time.